Okay, so I'm going to give my half, and then we'll proceed with questions afterwards for both of us. So I'm going to shift gears. My expertise is in personalized medicine. I'll show you essentially what I invented for budding docs. It's a new age that we've entered into, and there's going to be a lot of changes happening in medicine. And I'm preparing our university for that. This is where we are. It's SUNY Upstate Medical University in Syracuse, New York is where this is. And I'm colorblind. You may see this dot, and I can't. That's why I'm flipping it on and off. Anyhow, SUNY Upstate is a State University New York Health Center that's right next to Syracuse University campus, but is a state organization. It is not affiliated with SU, even though it's right next door to it. Okay, so I'm going to start off with the old and the new. The old, 20th century medicine, we're going to compare and contrast. And if you read this, I think this is so befitting. This is how I got my health treatment in the 20th century. Not very impressive. This is the new. All right, do you recognize this? Jeopardy, okay, Watson, the supercomputer. They are now devoting, IBM is themselves, to providing information capability to physicians. It's going to change healthcare a lot. So are a number of other things. 21st century medicine, you're going to see a shift in healthcare from diagnosis to prognosis, from reactive medicine to predictive medicine. That's what's given rise to Lee Hood, who's a physician, MD, PhD in Seattle, Washington, to call it P4 medicine, which stands for predictive, preventive, personalized, and participatory. Predictive, genomic information will now that it's available, the $1,000 genome is not far away, a year or two maybe, to provide a lot of information on what health problems you will have when you're born, what you will get when you're older. I know it's an ethical, legal, social quagmire, but it's there, and there's no stopping technology for laws and regulations. Preventive, you can prevent a lot of what could happen to you with information that comes from the genome and other aspects of medicine today. It's personalized. It's no longer, I'll provide a definition in a moment, what I mean by that. And then it's participatory, and this is where social medicine, social media comes in. Patients are online, they're interacting, and they're talking a lot, and if the physicians aren't aware of that, and that the information is out on the web, and that the patients have access to all that information, in many cases more times than the docs do, then they won't be keeping up with the program. So I want to define personalized medicine. It's what I do, it's what I teach. I've been at SUNY Upstate Medical University for 27 years. I teach budding docs. It's all I do now. I used to do molecular biology research, but now I'm full-time teaching and administration. And we're starting off on cutting-edge medicine, I think, with them there. And the whole idea of personalized medicine is one size does not fit all. This slide, in my opinion, illustrates the point perfectly. The wicked stepsister's foot does not fit into Cinderella's slipper. Another genomic pioneer, Craig Venter, says people in medicine are trained in averages, reviewing average clinical responses to weigh treatment decisions. And yet, each of our genetic codes is going to be totally unique. So it's not a one-size-fits-all world. We did it in the 20th century because that's all we could do back then. Today, we can do personalized medicine. We can actually dovetail treatments to the individual patient's genome and to their own particular personal needs, which is where social media comes in. So there were two major converging technologies that occurred over the past decade, and together they work synergistically. Now, either alone would be transformative, but combined, they have a synergistic effect with each other. And that's the Human Genome Project in the internet. And I've exploded that diagram here with the Human Genome Project and the internet on the poles. And this is what I teach our new budding docs, this information here. To understand personalized medicine, you really need to know all of the different nodes and the connectors between the different nodes. The red is everything that's related to Human Genome Project. The blue is everything that's related to internet. We're going to consider health data to be a big black box, because that's not what I'm going to talk to you about today. I'm going to talk to you about the social media aspect shown here, which of course relied on the internet, which is not that old, 20 years old, and social media probably 10 years old or maybe less. And let's see now, how do I don't have a, so can you, can you mouse over the smiley face? I'm used to having a laptop here where I can do that. If you mouse over the smiley face, yeah, just, does it work? It's a video. Okay, we won't worry about it. I actually have 3 embedded videos that, in the video I think makes the case a lot better than just me standing up here speaking. I wish you could see it. And that's what makes video, of course, is a part of social medicine, and it's just more palatable. It's easier to appreciate. But the bottom line is that patients are in contact with one another all the time, especially the more chronic the disease, the more patients are leaning on each other for support, and they're sharing information. They're sharing information about their diseases, about doctors, about hospitals, and they are wired and they are prepared for anything. And the video that I was going to show was taken at the 2009 ePatients Conference. It's coming up again in September in Philadelphia. And this is the website you go to want to learn more about that. See, the thing is, if patients are so incredibly connected through social media, if docs aren't, then they're out of the loop. It's as simple as that. I saw that coming, and that's why I said, well, we can't train our physicians at SUNY Upstate anymore without an awareness of what the patient knows. The training that we've been giving over the past 27 years at SUNY Upstate does not meet the need for the 21st century. So it's a big change that's going to have to happen. Much of our lives are now lived online. Huge social media landscape. Chris knows so many of these different aspects and is connected to all of them. I know a few: YouTube, Facebook, Twitter. Twitter is what I use the most, and I'll show you how. I'm going to give you, I know we had some raised hands here. I was trying to keep time with my phone, but it's buzzing me. So I know some of you raised your hand for Twitter. For those who didn't, this is a short Twitter tutorial. This is my Twitter homepage. I use it a lot because it's very easy to get information. And I am an information freak. I thrive on information. And it's the best way to get it. I don't need newspapers. I don't need TVs. Twitter does everything, all right? Doesn't mean I don't read newspapers and I don't watch TV. I do, but this is where I get, and so I'm constantly wired all day long. I have to be, because my job is to treat our budding docs at SUNY Upstate in the latest technology so that they will be prepared, bearing in mind that when a medical student enters medical school, it's 10 years down the road before they start their practice. We need to train them for what's 10 years down the road, not for what happened in the 20th century, as we are doing now. So anyhow, coming back to Twitter, you type your tweet in here, where I just illustrated, and it shows who I follow here. It shows how many are following me, 1,500 roughly, followers, and it's around 2,000 now. I'm following around 1,500. If you want to get in touch with me, you need to simply type into the tweet window @WestR, and I will see your message. That's how easy it is to communicate with people. The @ is the postage stamp that sends it directly to me. Now I'm going to show you a higher level of organization than this, but only subtly so for those who don't use Twitter. And I'll talk about that in a moment. But just to show you that there are out there what are called Twitter clients. One that I use is called Seismic. It's in really tiny print at the top of the screen. And this is a screenshot of my computer monitor. And what it's showing on the far left, it's showing my entire tweet stream. So everything, all 1,500 people I follow, this is a stream. That's why it's called a tweet stream, and it just continually runs down. And if you're wondering how you can keep track of that, well, your brain sets up a hierarchy, and certain faces work well in particular, or icons for companies, and you learn which ones that you want to prioritize over others. That's how it's done. And then the second column is everything that's been sent to me using that @WestR tag, all right? So it's not personal in the sense, this is very public information, even if it's personal information being exchanged to the world. This is a private conversation I'm having here. This is like text messaging with cell phones. And then this column here is my course, what's known as hashtags, so the pound symbol. So it's PM 101, the course I teach, Personalized Medicine 101, and it serves like a filing cabinet. And if all my students or anybody out there who follows me wants to know anything about personalized medicine I think is important, then you would simply, with your Twitter client, follow the PM 101 hashtag. So then a little bit more about the hashtag. All healthcare venues, so that the pound symbol is called the hashtag, and it's a venue, not a person, all right? It could be an organization, it could be a chat, it could be a filing cabinet like my personalized medicine course, PM 101, and they're all maintained at healthcare hashtags, and some other examples include one I just showed you, PM 101, healthcare social media that Maya, Chris, and I use all the time. If you're in healthcare, and you wanted to know how social media was to help you, you would want to follow closely the HCSM hashtag. Another one that you might be interested in is hospital, and there are other ones like this. This healthcare hashtags website has around 500 different registered healthcare hashtags. And of course, not to mention NAPH that we're live tweeting on now. So Maya's tweeting, Chris is tweeting, I was tweeting, Chris's talk, Chris is tweeting mine, Maya's tweeting both, all right? So that people elsewhere in the world who want to know what's going on here are following us right now. And we are very fortunate because all of this is provided by the Fox Group, which is a healthcare consultant organization that involves Thomas Lee and Auden Utingen. And they do this so far free for the healthcare community, and it's just a great service to have. A couple other hashtags. I participate in one called MedEd. It's held, these tweet chats are 1-hour sessions where you get together and you meet with people around the world. It's so convenient to do. You don't have to be in a meeting room like this. You can be, well, I've got back problems. I'm often lying flat on my back on bed with my iPad or iPhone and tweeting in a tweet chat, and I'm communicating just like we are right now in this room. All right, and these are scheduled events, and this is one I attend called MedEd, medical education, and there's docs and professors that are involved, and students are involved in this, and from around the world they get involved. Another one, this is the last one I'm going to show you, Healthcare Information Technology Social Media, set up by Erica Olensky in Dallas, Texas, held Mondays 9 to 10. And I just wanted to show you this because the topic 1 of this past Monday at this tweet chat was, is it realistic for social media and EMRs to merge? I assume that most people out here are familiar with EMRs, or electronic medical records, or electronic health records, and And the question here that this group is dealing with is, can the power of social media be wired into the electronic health record? And so the entire chat for 1 hour was a discussion of people who are interested in this type of thing. You don't have to be a professional at it, and you don't have to participate. You can do what's called lurk. You can just listen, all right? You don't have to say anything if you don't want to. And it's just a great way to learn and actually be on the cutting edge and actually invent for your organization something that's going to be very relevant to it. And if you're inventing for your organization, that's certainly going to be protecting your job, right? They're not going to want you to leave. So